Hello, everyone, and welcome to the Hub Innovation Series. Today's session will feature representatives from Prediomic, a new innovation aimed at increasing access to cost-effective cancer management in Brazil, Latin America, and potentially around the world. My name is Ebele Anidi. I'm the Director of Partnerships and Engagement for the G20 Global Innovation Hub for Improving Value in Health. The Hub Innovation Series aims to foster and support innovation across the G20 member states by providing a platform to spotlight innovative solutions at the forefront of ushering in a new era of high-value health systems. Today, through a partnership with the Health Systems Innovation Lab at Harvard University and FGB, this episode will spotlight one of the winners of a recent hackathon event focused on digital solutions for building high-value health systems in Latin America and the Caribbean. Prediomic, a non-invasive, cost-effective tool to support precision medicine for cancer management. Born from a team in Brazil, Prediomic places an explicit focus on advancing health equity through a new cancer care solution that circumvents the traditional financial barriers that prevent patient access to quality cancer treatment across Latin America. With Brazil at the helm of the G20 presidency in 2024, it's pretty timely to spotlight a Brazil-based solution and Prediomic's efforts to deliver value at the national and regional levels via a practical tool with the potential to minimize wasteful and unnecessary testing, reduce healthcare costs, and improve health outcomes for patients, especially people living in low-resource settings. Felipe and Wellington Pimenta are joining us today to share the Prediomic story. Welcome, Felipe and Wellington.
Thank you, Ebele.
Yeah.
So, let's dive in, and we can kick things off with you, Felipe. A non-invasive, cost-effective tool for cancer treatment is a unique health innovation. Can you walk us through the innovation journey for Prediomic, and why is this innovation particularly relevant for people in Brazil and across Latin America?
Sure, thank you, Ebele. And first of all, I'd like to thank you for such a brilliant introduction of our idea. And I have to also recognize the role of the Innovation Lab. They made our incubation process, which was very important for our development, and FGV and the hospital of Syro-Lebanese as well. So, Tarina, if you would be so kind to step through this first slide. So this idea actually started as a research project, and the next one, please. Yes, perfect. So this started as a research project. Me, Wellington, and Cecilia, which is another part of this group. We used to work together. We are radiation oncologists, and Wellington is a physicist. So we started to make some research regarding the use of machine learning. However, unfortunately, this type of research of involving deep techs here in Brazil, they're really hard to come off out of the paper here. So we struggle a little bit to start our research. However, we identified a gap in health service here in Brazil. There's a gap between the private sector and the public sector. And regarding cancer, we know that molecular advance leads to a change the way we treat and we understand the patients with cancer. Basically, Prediomic is a cost-effective way to assess mutation and predictions of tumors. Right now, we already have a prototype that would be able to start running clinically, so using real-world data. And with this, we are able to predict the chance of certain patients to have any specific mutation. And with this information, we can drive our resources to make a better allocation of them, to perform like more expensive tests that would be confirmatory, not just for screening for those patients. Therefore, we can improve access for patients once we have those at higher risk to present clinically relevant mutations. So this prototype is almost done, and we are about to publish our first results because, as I mentioned, this is started as a research project, and we are passionate for research. So I think this is our most strong point because everything that we are doing, we're trying to scientifically validate it to the public and to ensure that we are providing a high quality innovation and framework. And the most important of these frameworks, just like Wellington said, this is scalable, not just horizontally, but vertically as well. So this project started with one specific question, which is which patient has a higher chance to present the MGMT methylation, just for those patients with glioblastoma. But of course, the idea is to scale up and be able to bring more information about other types of mutation and other types of disease. And this is not just for brain tumor, but for lung cancer, breast cancer, prostate, and so on and so forth. So I believe that right now, the idea is to make partnership, because just like every other AI based tool, the more number of patients, the more number of cases that we have, the better prediction, the more accurate prediction we would get. So we truly believe that this could be meaningful for low and middle income countries, where patients they just don't have access to like what we say that is the gold standard medicine, but not exclusively. It could be used in any current country. I believe we can make some adaptations. So right now we are starting to run in real data with real patients. However, through partners, new partner, I believe could do so much more with it. Wellington, if you like to complement.
Yeah, just to pick to draw a quick picture. Imagine you're a physician and you have 10 tests on your hand. You can only test 10 people, and you have 100 patients, and that needs to be that has that condition. So which ones are you going to choose to use those 10 bullets essentially you have? So Prediomics is that tool that will help you really select those with higher probability of having that mutation, and then you can drive those resources to those patients. That's pretty much the idea.
You know, I understand that there you're well in the early stages in any innovation cycle. There are definitely some challenges that come up, and so would be curious if both of you could speak to maybe one or two of the challenges that your team faced during the journey to establish Prediomic, and what have been on the flip side some of those really important enablers that have supported and accelerated your progress to date. I mean, you were one of the winners of the regional hackathon that we did in partnership with Health Systems Innovation Lab, FGV, and other partners. And so you clearly had an idea, concept, and innovation that caught the eyes of the judges and have really set you up for success down the line. But maybe you can speak to the two sides of the coin of some of the challenges that you faced, but also some of the enablers that have really accelerated your progress to date.
Sure, Ebele, and that's a really great question, because uh, I can say that the first great challenge that we faced was to change our mindset, because we were used to perform academic research, and that was the time that we are trying to use this type of research, but transform it into a solution to innovation that in a way that we can change patients' lives. So that was really difficult, because we were worried about how to publish and how to scientifically prove this type of innovation. And this is important, of course, but this change of mindset was really hard at the beginning, and now it's become more naturally. And I used to say that I have one of my mentors, and he used to say this is a continuous process. It's like a spiral, and every time we make this process of pitching and ideation, proving our concept, we are becoming better, and this has become more naturally for us. So this is endless. We are continuing to learn, and I believe that that's also that's the main role of some partners that we came across during our journey, such as the Innovation Lab. And I also have to recognize, for example, Professor Rifat Atum, because he was responsible for the hackathon that really changed the way we see our solution. Before the hackathon, we used to see this just like a scientific idea to be published, and that's it. And now we see that it could lead to something bigger. And Chip, for example, which is also director of the Innovation Lab, and he became a really good friend, and the FGV that provide us all of the environment to develop this type of idea. And of course, uh, I brought this quote over here because we cannot get to anywhere by ourselves. If you ask me, like 1 year ago, we started this research like maybe 2 years ago, and if you ask me like 1 year ago, I would never imagine that we could be over here talking to you and be able to share our ideas. And I think this is the most important aspect of our group. We believe that we can change the way you treat patient and the way you talk about healthcare by doing this together with collaboration, and this is the most important thing. So this is why I use this title for this slide. This is lesson being learned, because we just never stop learning, and we are always trying to connect and to becoming better.
Well, thank you so much, and I want to I see here that you're sharing the QR code here to invite people to join your movement. And Felipe, Wellington, what you just conveyed is so interesting and so powerful. This idea of a tool, a predictive tool that can really support clinicians, support patients, support clinicians in being able to make more strategic, cost-effective decisions, and support patients in ensuring that they receive access to timely and appropriate care is really a unique idea. And as you said, you are in a stage of looking to expand and grow your partnerships. And so my hope and our hope here at the Global Innovation Hub is that in giving you this platform, giving you this space to share your story, is that this invitation for partnership gets extended across our partners in Brazil, across our partners in Latin America, and even the world who are interested in learning more about how your tool is developing, maybe even reading the subsequent results that you put forward and some of the reporting that you're going to be doing. And it sounds like you both are opening the door for that partnership and for that collaboration. And so rest assured that whoever's watching this episode today will definitely receive that invitation, and that we at the Global Innovation Hub will continue to work with you and our partners at the Health Systems Innovation Lab and FGB to make sure that this gets shared across our respective networks. I want to take a moment to thank you both for a truly compelling presentation and an introduction to Prediomic. We're going to move forward here with the hope of ensuring that everyone who tunes in has the opportunity to connect with you. We'll post up now your contact information, Felipe. Obviously, anyone who's watching, we welcome you to connect with us via LinkedIn or across our respective websites, or connecting with the Prediomic team directly. On behalf of the Secretariat of the Global Innovation Hub, we hope that you thoroughly enjoyed today's session, and we look forward to having you tune in next time for the next episode in the Hub Innovation series. Thank you, Felipe and Wellington.
It's been a pleasure, Ben. Thank you so much for this opportunity.
Yeah, thanks for providing this space to us.
Of course.